Hello and welcome to Irish Medical Training Solutions. Donal Lonergan is my name. I've been a paramedic for the last 20 years, and over the next couple of weeks and months I'm going to be releasing videos on first aid in the home. So the most important thing about these videos, they're not to replace a first aid course. So I would highly recommend that you go and do a physical first aid course somewhere that you can actually get feedback and ask your questions. As a friend of mine always said to me, two is the most important things in life. One being able to swim, and the second is first aid. So let's talk about scene safety, most important when you're dealing with first aid. So if we're in the home environment, things we're looking out for, if somebody falls and slips on the floor, as in most houses now, there's laminated flooring, and any drop of water on that can make it an unsafe environment. Other things that you have to be very careful of too, if people are plugging in plugs, they're holding on to an extension lead, electricity, smoke as well, and we have them coming up in future videos about how to manage them situations. Also be very careful as well when you're out in the general public as well. If you're walking down by a bar or a club in the night time and somebody gets injured, be very, very careful about how you go and helping somebody, because the most important person in the scene of any incident is yourself. Okay, so let's talk about calling an ambulance. This is very simple. You ring 999 or 112, and 112 is the European number, and if you're looking in from America, it's 911. So the first thing when you get onto ambulance control, they'll ask you your name, your location, your phone number, give them all the details. The most important thing is that they'll help keep you calm and to stay on the phone with you until such time as the emergency services arrive. Does every call need an ambulance? Absolutely not. So stuff like, limb injuries, hurt your finger, hurt your elbow, maybe in some cases you just need to go to your own doctor. So the most important thing is to stay calm and listen to what they say on the phone. Let's talk about the primary survey. The primary survey is a global assessment that's covered all over the world at all levels, from first aiders all the way through to doctors. So the first part of the primary survey is airway. Is the airway clear and patent? And shortly we're going to talk about that. The second part, we're going to talk about breathing. So when we're looking at a person's breathing rate, the average adult is 12 to 20 breaths per minute. And with pediatrics, dealing with children, we're going to release a whole section on that in the coming weeks, so keep an eye out for that. And the other one then is circulation. So we talk about pulse, skin colour, temperature and cap refill, and we'll be talking about that shortly. Here what we're going to do is check for a radial pulse. When we're looking for a radial pulse, we're going to go along, we're going to follow the thumb up along. We're going to go along, we're going to find there's a little, between here and here, what you'll find is a bit of muscle, and there's a little dip in the middle. So what you do is you go along and put your hand in there and press ever so gently. Now in some cases what you might find is you might have to go a bit deeper, but in most patients what happens is you can get it up here. When we catch hold of it, remember the average pulse rate is 60 to 100 beats a minute per the average adult, and for children it's slightly different, and we'll be covering that in the coming weeks. So when I get a pulse here, what I normally do is I count. I go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And I count it out for exactly a minute. So if you're sitting at home this evening, you're watching television, just practice going along, getting your pulse. And over a couple of nights, you'll actually get better at it. Another thing you have to be careful, remember playing hide and seek as a child and you were hiding in behind the wall, and the next thing suddenly you could hear your heart beating away in your chest. You have to be careful in emergency situations that what happens is when you go along, and in some cases you go to check a pulse, what you can do is hear your own, and we'll talk about that later on. So the most important here thing with this yet again is practice. So in this one now, what we're going to do is we're going to do a carotid pulse. So a lot of people have difficulty in finding a carotid pulse, and it can be quite difficult as well dealing on the type of patient, and we'll cover that over the coming weeks. So what we're looking at here then is the Adam's apple, and either side then, if you turn the head slightly sideways, this way, you'll find a muscle here. You can feel it on yourself. Be very careful you don't hurt yourself now when you turn your neck. So what we're going to do then is we're going to look here, we'll find the Adam's apple here. We're going to go into this section in here. You can follow your trachea around or your windpipe and you'll find it in here. So we press 2 fingers in and there's the pulse. I don't know, hopefully you can see it bouncing here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And the thing is, yet again, like the radial pulse, we're going to count it for a minute. The other thing too, be very, very careful about when you're going after the pulse. Never, ever, ever do it with both sides like that. And be very careful when you're going in, you're just going straight in. Don't start rooting around inside in the patient's neck, or you could cause maybe a small bit of damage, especially if you're dealing with a lot of older people as well. So be very gentle when you're going in there. Find your spot, come down along and straight in there and catch it from that point. Section, as we talked about the primary survey, we're looking at our patient here, and the first part of the primary survey is always airway. So we're going to look after a patient's airway. As you can see, our patient here, he's sitting upright. He has a nice long neck, and he's moving air quite freely. Now, the biggest thing you must always remember when you're dealing with an airway then is a simple pipe, and that's what we have inside here. And the problem is then that if the head goes down forward like this, what happens that you'll notice inside then that the airway becomes slightly blocked. And in some cases what happens, it can be totally occluded like that. As we go along then and we lift the patient back upwards, what's going to happen here is that the airway is going to open back up and allow air to move. So if you want to try a little experiment at home yourself, so sitting on the chair or the couch, wherever you are, and if you have no neck issues or back issues, please just lift your head forward like this, lean it forward, and you'll find it's quite difficult to breathe. If you tilt your head right back up, what you're going to find is that air moves in and out. When we're dealing with the second part of the primary assessment, we notice here that we're talking about breathing. So if you can see that the patient here, I've asked the patient to exaggerate his breathing, so you can see that the chest is rising and falling. A little experiment I want you to do now, first and foremost. Can you sit at home, wherever you are, put your hand on top of your chest and see, does it rise and fall that much? No, it doesn't really. So if you want to do that there. So if you put your hand on your chest, on an average day, it doesn't really rise that much. Another thing you have to be careful as well is that down here that some people are abdominal breathers, and that you'll find that their belly moves more than their chest does, and that's predominantly with children as well, and that's in our later videos. So what we're talking about here then, when I'm measuring the patient, so we always have to be very careful of dignity, especially when we're dealing with ladies as well. We don't need to be putting our hands, so ideally for good safety purposes, put your hand here and put your hand over it as well. And we're going to count the rise and fall of the chest. So yet again, like doing a pulse check, we're going to do it over a minute, and we're going to start off counting now. So we have 1, 2, 3. And remember, the average breathing rate for the average person is 12 to 20 breaths per minute. How do we know that they're breathing well? Is a good skin colour as well. You can see it there. The patient is perfused and the patient is looking directly at you. And the patient may be able to say, how are you feeling?
Fine.
He was able to get that out in one sentence. Here we're dealing with cap refill. Cap refill is normally used on a shock patient and any kind of sick patient. So what the patient is going to do there, we're going to squeeze the thumb for 5 seconds, nice and hard, but not hurting the patient. 4, 5, take it away, and you can see the skin colour has returned within 2 seconds, which is a good indicator of perfusion and oxygen moving around the limbs. Thank you very much for taking time to watch the video. The most important thing here is that we're going to take out that we look at number 1, scene safety. So we've discussed some of the issues that you're looking for around the house, and in my up and coming videos we'll go more detailed into that. So we talked about calling the ambulance, what to do. So we talked about the numbers, our 999 and 112 in Ireland, and both in Europe is the 112, and if you're looking in from America it's 911. The other part then we're looking at is the primary survey. So we're looking at airway, so we talked about having the airway clear and patent. We talked about the breathing rates, which is 12 to 20 breaths a minute, and we're also looking at pulse rates as well. And the pulse rate in the average adult is 60 to 100 beats per minute. So thank you for taking the time to look in today. Please like and subscribe.